Today I'm going to be giving kind of a 30,000-foot view of understanding alcohol and sexual assault and kind of what we know from the research in that area, as well as some implications for prevention and intervention. So just briefly, as you all likely know, sexual assault includes physically forced oral, anal, or vaginal intercourse, intercourse when consent cannot be given due to the victim's impairment, verbally coerced intercourse, as well as other types of forced or non-consensual sexual activities. So we're talking about sexual assault broadly, not just rape specifically, which would involve intercourse. When we look at our US national samples, and these vary some from country to country, but in the US, the studies are pretty clear that about half of women and almost a third of men report having experienced sexual violence of some form with physical contact during their lifetime. What we do know is that although both men and women, and of course non-binary folks as well, although the research is less clear on people who identify as a gender other than male or female, we do know that rape is typically perpetrated by men, whereas victims can be really anyone. So in terms of sexual assault rates, we find that when we look specifically at the population of people who drink alcohol, those percentages tend to go up. So in studies that we've done with young female drinkers, in our samples, we found that up to 80% have reported some form of sexual assault victimization in their lifetime. And in studies that we've done with young male drinkers, just over half have reported some form of sexual assault perpetration in their lifetime. When we look at sexual assault specifically and kind of what are the rates across different types of assault, we find that in college student assaults, about half tend to be associated with alcohol use. And that in these assaults, it's most common, in fact, in over 80% of cases, that both the perpetrator and the victim have been consuming alcohol. But when we look at those two individuals separately, it tends to be about 3/4 of perpetrators and just over half of victims were drinking alcohol at the time of the assault. So that makes alcohol really the most common date rape drug. And so we really need to be focusing on alcohol specifically when we're thinking about kind of drug facilitated sexual assault. Other drugs are also kind of commonly used in conjunction with alcohol, but that's kind of one of the issues in some of the research is that it can be difficult to isolate incidents where alcohol wasn't consumed with the other drugs that might have also been consumed. So I think we need more research in that area. But I'm going to focus on alcohol here today. And what the research is very clear about is that alcohol has complex effects on both the victims and the perpetrators, all of which contributes to sexual assault happening. The research to date has been primarily focused on men as perpetrators and women as victims. And so that's the way I'm going to frame this discussion today. But as I said earlier, that doesn't mean that's how it happens in every single case. Women can be perpetrators, men can be victims. But by and large, when we're talking about sexual aggression, it is men who are committing the bulk of the assaults. So thinking about alcohol-involved assaults specifically, there are different types of alcohol-involved assaults. And these vary based on a few things. One is whether or not the consumption of the alcohol was voluntary or involuntary on the part of the victim, and also the level of victim impairment. And so the way these have been defined in the literature previously is that alcohol facilitated rape or assault is typically involuntary consumption on the part of the victim. And generally, she is quite intoxicated. She's either passed out or kind of completely physically incapacitated. Incapacitated rape or assault refers to voluntary consumption. So she drank the drinks on her own accord, but at a similar level of intoxication as alcohol facilitated, in which someone may have, spiked her drink or given her a stronger drink than she anticipated, for example, plied her with drinks after she was already pretty inebriated, those sorts of things. And then we have impaired rape or assault, which is also typically voluntary consumption on the part of the victim, but involves a lower level of victim impairment. So what do we know about these types of assaults compared to sober assaults? Well, generally, alcohol-involved assaults are more likely to involve a casual acquaintance. They're less likely to be planned. They're more likely to involve time spent at a party or bar, which makes a lot of sense. And one of the areas of research that I do as well is kind of this intersection between sexual violence and sexual health. And so I've done a lot of work on looking at condom use during sexual assault incidents, as well as the ways in which people use coercion to avoid using a condom, even in a consensual sexual situation. And so one of the things that we find is that alcohol-involved assaults are less likely to involve condom use compared to sober assaults. Within alcohol-involved assaults, we can also look at kind of the range of intoxication levels across different types of alcohol-involved assaults. And what we tend to find are that greater intoxication during the assault is associated with more isolating and controlling behaviors, greater misperception of the victim's sexual interest level, so thinking she's more interested than she is. And Tony Abbey's done a ton of work on that. Greater aggression on the part of the perpetrator during the assault, as well as less resistance on the part of the victim during the assault. And both of these things taken together tend to lead to more severe outcomes, meaning that it tends to be more likely to result in a completed rape rather than, say, an attempted rape that was then ended for some reason. So why? Why is alcohol so heavily involved in these kinds of assaults? In psychology, we have two primary explanatory models for alcohol's effects on behavior, and these cover all sorts of behaviors, not just aggression, but anything that we do, essentially, how we interact with others generally, etc. These are alcohol expectancy theory and alcohol myopia theory. So I will very briefly describe what these are. So alcohol expectancy theory has sometimes been referred to as the psychology of the drink. This is referring to how our beliefs about how alcohol is going to affect us. We all tend to have beliefs, even if you have never had a drink of alcohol in your life, based on living in a culture where alcohol exists and is consumed. We have expectations about how alcohol affects people's behavior generally and our own specifically. And so these will be things about, how I feel when I'm drinking, how I behave socially when I'm drinking, those sorts of things. They're influenced by our culture. So if you live in a culture where alcohol is associated with aggression, you yourself will be more likely to have that belief than if you live in a culture where that linkage isn't really part of the culture. And what the research has shown is that these can often lead to self-fulfilling prophecies, such that if I think I am more likely to become aggressive when I drink, lo and behold, I am more likely to become aggressive when I drink. And we could talk some about causality, et cetera, later, but there tends to be an association. Now, there's also alcohol myopia theory, and this has been referred to as the physiology of the drink. As any of you who have consumed alcohol know, alcohol leads to pharmacological cognitive impairment due to its effects on the brain. And what alcohol myopia theory is referring to specifically is its effects on our ability to attend to things in our environment. So alcohol has widespread effects on our executive cognitive function, our judgment, our memory, our ability to plan, all sorts of things. But in particular, what this one is focusing on is that attentional piece. And the idea here is that when we are cognitively impaired due to the effects of alcohol, we're unable to attend to all of the cues in our environment as we might if we were sober. Instead, we can only focus on the things that are most salient or immediate in front of us, and the things that are more peripheral or removed are harder for us to attend to. So how does that play out in alcohol-involved sexual assault? Well, when we look at victims and alcohol, those who, were victimized during intoxicated states, we find that looking at their alcohol expectancies, when they were going into this drinking situation, they were often expecting, you know, it to be fun. They were expecting maybe that alcohol would facilitate their ability to be social or romantic. They might have been expecting that alcohol would make them feel less anxious or nervous in this party situation where they didn't know many people. Those were the kind of things that were on their mind. They weren't expecting it to increase their risk for being victimized. So they're already kind of oriented in one direction. Um, but then you couple that with alcohol myopia, which is decreasing their ability to process the information that's happening in their environment. And so what the research has shown is that intoxicated victims are less able to detect sexual assault risk cues, especially if those cues are ambiguous. It can be difficult for them to switch gears from being this kind of social setting and wanting to have fun with their friends or potential sexual partners, even to switching to, oh, wait a minute, I'm in danger here. And that can often lead to increased uncertainty about what is happening and how to respond to it. And what that ultimately can do is then lead to more ineffective resistance or paralysis when faced with the risk of being sexually assaulted. So that is not in any way to blame victims for what's happening. It's just a way to try to understand how alcohol may be affecting their behavior in those situations. Studies have been looked at that have compared victims who were intoxicated at the time of the assault to those who were sober. Those who were intoxicated blame themselves more for the assault, and they also feel more stigmatized by others for the assault compared to sober victims. And they are, in fact, accurate in that perception because others do report blaming them more than victims who were sober at the time of the assault. They're often also viewed by others as less credible than sober victims. And as you can imagine, this has, huge implications for reporting. It has huge implications for whether or not a case proceeds through the criminal justice system, as well as whether or not they are able to access healthcare after the assault. So, due to the impact of alcohol on, potential sexual assault victims, there has been you'll see a lot of focus in the media, social media, other media around how can we reduce, women's risk of being sexually assaulted. Um, you know, you'll see lawmakers, at least in the U.S., say things like, "Well, if women would just stop drinking, there wouldn't be a problem with rape." Um, that sure, okay. Also things like let's designate a sober party goer so that that person can then stay aware, protect their friends, all sorts of things. There's reliance on technological advances. There's nail polish that will detect whether or not your drink has been spiked with a drug. Um, there are very effective sexual assault resistance programs, and Charlene Sen has one and has published a lot of great data on the effectiveness of EAAA. And these strategies are important. And I think that they are things that we definitely, we need to be doing. But like this very old tweet, it was still a tweet back then, says, if you're promoting changes to women's behavior to quote unquote prevent rape, you're really saying make sure he rapes the other girl. So what does that mean? It means that if we really want to talk about preventing rape, making sure that a rape doesn't happen, we need to focus on perpetration and perpetrators. We had a young man in one of our focus groups, and these men were not selected to be perpetrators in this particular study. But we asked them in this focus group, kind of how do you decide, which person you're going to go up to at a party and maybe try to flirt with and maybe have sex with later. So not even anything about aggression. And we had this one participant who said, I pick the sickly one from the herd. And our moderator followed up on that and he said, well, what do you mean by that? And he said, I find the drunkest girl there. And our moderator then said, oh, okay, so then like what would happen if, her friends came and took her away or, she left the party or whatever happened? Oh, I would just go find the next drunkest girl. So a woman at that party who had engaged in some of these risk reduction strategies may indeed lower her risk of being assaulted that night by this particular individual. But he will go find someone else who is not engaging in these risk reduction strategies. And so if we really want to prevent rape, we need to focus on the people who are doing the raping. And so that has led to my work on intoxicated perpetrators. When we look at perpetrators who committed their assaults while intoxicated versus those who were sober, what we tend to find is that compared to sober perpetrators, intoxicated perpetrators, they consume more alcohol just generally in their lives, but they also consume more alcohol in sexual situations. They tend to have these stronger beliefs or alcohol expectancies about alcohol's effects on their sex drive, as well as women's interest in having sex. So for them, alcohol is associated with go cues around sex. They also tend to be more impulsive. But there's a heterogeneity of effects across perpetrators who consume alcohol. It's not monolithic. It's not that, oh, well, I drink and, so then I commit assault and that's the way it works for everybody. In reality, it works in conjunction with other individual risk factors. And so what we see is that there are stronger alcohol effects with men who already have more misogynistic attitudes, who already have tendencies to misperceive women's sexual interests, even when sober, and who have these expectations that alcohol makes they themselves more aggressive and women more vulnerable to sexual coercion. So you take those kind of pre-existing attitudes and beliefs and couple them with the cognitive impairment of myopia, and you can see how the state of being intoxicated might exacerbate the likelihood of sexual aggression happening. Because he's going into that situation focused on what's salient for him, which is that she's more sexually interested, she's going to be vulnerable. And what's more peripheral for him is her resistance or her disinterest or her lack of consent. And because of those cognitive effects of alcohol, he's not able to process those as effectively as he might if he were sober. We've also done studies looking at kind of how much perpetrators drink across different types of assaults. And so in this particular study, we recruited men who were perpetrators. And what we found was that most perpetrators reported committing multiple assaults. And so what we did then was a comparison of how many of their assaults involved alcohol versus not. And what we found was that almost half reported that they had never consumed alcohol during their assaults. A little over a quarter had always consumed alcohol during their assaults, and about a quarter had inconsistently consumed alcohol during their assaults. So some of them were committed while sober and some while intoxicated. So there's a wide variation there, and each of those groups of perpetrators may need different intervention strategies. There was also a wide range in consumption levels. So this is an important area, I think, for future research, is that we often ask, was alcohol involved or not? And that's the level of specificity we get to. We very rarely then dive in and say how much, over what period of time, what were the perceived intoxication effects that you were perceiving, or that you felt, et cetera. So what we found in this study was that the average number of standard drinks that perpetrators reported consuming was 8 at the time of the assault, but the range was really wide, 3 to 26. We also computed an estimated blood alcohol level based on the time over which they consumed those drinks, as well as their body weight. And what we found was an average of 0.07, which is just under the legal limit for driving in the US, for example. There's still impairment, but it's not as strong as as intoxicated as you see in the range below, which was from 0.01 to 0.26, which is severely intoxicated. So again, that's something that we need to be thinking about when we're thinking about prevention. The other thing that is, something to think about as well is the use of alcohol as a tactic. So not only, are perpetrators themselves drinking, but as I described in that example of the young man in our focus group, they will use victims incapacitation as a tactic. And this is not necessarily feeding them drinks or spiking their drinks or making them stronger or anything like that. It's often they're relying on the victim's voluntary consumption of alcohol. So how does that work? So I'm not going to dive super deep in how, blood alcohol level works, but I just want to give you kind of an overview so you have a sense of how this can function. So the top chart here is for people biologically born male, bottom biologically born female. Across the top, you'll see the number of drinks. And on the left-hand column here, you'll see body weight. And then in the cells here are the estimated peak blood alcohol level that someone would experience if they weighed that amount and drank that amount of drinks within a relatively short period of time. So what you'll see here is that a man who weighs about 150 pounds and has 3 drinks will be at approximately 0.08, 0.09. A woman who weighs the same amount, 150 pounds, drinks the same amount, 3 drinks, she's at 0.1. So not a substantial difference there, but there is a difference, and that's due to how men and women metabolize alcohol differently in our bodies, and I can go into that more later. But she is more intoxicated than he is. Now, what we often see, though, across men and women is that on average, men may weigh more than women do. And so in this particular example, you'll see a man who weighs 200 pounds, drinks 5 drinks. He's at 0.1. That's pretty intoxicated. They would get a DUI if they were driving at that point. You take a woman who has drunk the same amount of drinks, 5 drinks, but she only weighs 125. She's at 0.2. She is basically double as intoxicated as he is. So, for people who don't necessarily understand the differences of how body weight and how biological sex affect how we metabolize alcohol, he may be thinking, oh, she's as drunk as I am. In reality, she's twice as intoxicated, and that's going to come with more significant impairment. So what we find with perpetrators who use alcohol as a tactic is that they tend to be more hostile towards women, less empathy, they have greater drinking problems, and they have stronger beliefs that women are more vulnerable to sexual coercion when drinking. So again, we need to be focusing on rape prevention rather than risk reduction if we really want to prevent rape because they will just go to the next drunkest girl at the party. So what are the factors that predict alcohol-involved sexual assault when we look at it again from this kind of 30,000-foot view here? Well, pre-assault perpetrators, they have specific types on average of alcohol expectancies, greater sexual interest, greater female vulnerability, greater personal aggression. They tend to also hold more misogynist beliefs and heavier alcohol use. You have someone like this who then enters an alcohol-focused setting. Now, obviously, they don't always occur in these types of settings, but often they do, or they at least start there. So at a party, a bar, a pub. What you have in this situation, in addition to just the alcohol, is you have intoxicated targets. And those intoxicated targets, if we think back to their alcohol expectancies, aren't necessarily on guard for being victimized. They're there to have fun and to party. We also have intoxicated bystanders. And so the people who could potentially intervene in an assault may be less able to. Going back to the intoxicated victim, again, greater cognitive impairment, confusion, less direct resistance. And then you have the intoxicated perpetrator who is going to engage in these more isolating and controlling behaviors. He also is experiencing cognitive impairment, which may cause him to then ignore non-consent. Other research is focused on emotional dysregulation. They tend to be more dysregulated when drinking and more aggressive. So how do we stop this from happening? Before I go into that, let me talk a little bit about how this kind of works all in conjunction. Because alcohol-involved sexual assaults work in the perpetrator's favor. You have this sexually charged drinking environment where potential bystanders or witnesses, if you're looking at it from a more criminological perspective, are intoxicated. You've got vulnerable targets, and you have greater aggression facilitation due to due to the perpetrator's own drinking. And then finally, post-assault. So not just looking at what happens to predict the assault, but what happens afterwards. We have this greater victim blame and stigma, which results in reduced reporting. But even if they do report, there's lower perceived victim credibility, and so it's less likely that there's any sort of punishment for the perpetrator or accountability even. So going back to our picture here of how this works, if we take away the victim, because we want to be focusing on prevention, and for a moment we set aside the perpetrator, one of the places that we can focus is on the setting itself. And we have potential here to intervene with sober bystanders, because sure, in a lot of these settings, most of the people are drinking, but not always. Often there are at least some sober individuals present. And so, as Tracy alluded to in my bio, one of the projects that we have done is something called Safer Bars, which is a project that Mary Koss and I are just completing. And it's a randomized controlled trial that was funded by National Institutes of Health. And in this project, what we did was, in conjunction with the Arizona Department of Health Services, we have been testing an intervention that's called Safer Bars. This intervention is designed for bar staff, so bartenders, servers, bouncers, any of the kind of front-facing staff within an alcohol serving establishment, to train them on how to recognize situations of potential sexual aggression and then how to intervene, because presumably they're sober. By and large, they are. In this intervention, it's 2 sessions. They're 2.5 hours each, about 1 to 2 weeks apart. And we need to have at least 70% of the front-facing staff attend that intervention, and they attend it as a group. In our sample, we have finished data collection, and we're cleaning it and doing preliminary analyses on it now. We had 641 staff members across 41 bars and 41 managers. They were randomly divided into 2 conditions, either a waitlist control or an intervention group. The waitlist control, they came in for an information session where they were just kind of told a bit about the study, completed baseline surveys, then completed 3-month follow-up surveys, and then their bar could elect or not to receive the intervention, which most did. I think 95% did. For the intervention group, they came in to the bar, they did a baseline survey. They then had each of their sessions. At the end of session 2, they did a post-test, and then they did a 3-month follow-up and a 6-month follow-up. These are very preliminary results, but what we found on the left-hand side when we did comparisons within the intervention group, pre-intervention and post-intervention, we found that that group was reporting lower rape myths, more positive attitudes about intervening in potentially sexually aggressive situations. And they were more positive about the social norms about intervening. I mean, that was one of the things that we worked on in the intervention, was kind of getting them all to say that it's okay to intervene in these situations within their particular bar culture. The other thing that we did comparisons on was the intervention versus control group at the 3-month follow-up. And we found that there, in the intervention group compared to control, there was greater perceived behavioral control for intervening, meaning they felt like they could intervene if they chose to. And they also reported stronger intentions to intervene. So right now we're continuing our analyses on that to look at their actual intervention behavior. Hopefully more on that soon, but the analyses are ongoing. So essentially the question, can we intervene with sober bystanders? Well, our results look promising. So stay tuned for more information on that. Let's go back to our graphic here and think about other areas where we could intervene. So if we, again, take away the victim, because we have some effective strategies for dealing with the victim, like EAAA that I mentioned earlier, not dealing with the victim, helping potential victims reduce their risk for sexual assault. If we take away the setting, as well as the perpetrator pre-assault, and we focus on intoxicated perpetrators. One of the mechanisms that I'm really interested in is emotion regulation and emotion dysregulation, and that has been associated with increased sexual aggression among intoxicated perpetrators. So, what we wanted to know in the project I'm about to describe is whether or not we can improve emotion regulation when intoxicated. So, in this project, it was another randomized controlled trial funded by National Institutes of Health. We tested two brief online emotion regulation interventions for improving emotion regulation. One is cognitive restructuring, which is, very briefly, if you change how you think about a particular incident, you're going to change how you feel about it. And so we taught that skill to our participants who were all sexual assault perpetrators who were also binge drinkers. So a very high risk group. They were either randomly assigned to a cognitive restructuring condition intervention or to a mindfulness intervention. In the mindfulness intervention, again, it was very brief, 5 to 10 minutes, delivered online. But essentially, we taught them how to be mindful of their emotions, how to notice their emotions, A, and then B, watch them come and go like a wave. Not try to change them, but just notice what they were feeling and allow themselves to feel it without necessarily trying to change it. The idea here behind mindfulness, just very briefly, is that if you do that, if you notice and attend to your emotions without judgment, any distress that you have about those emotions will be lessened, and therefore you're better able to regulate those emotions. So we taught these interventions compared to a control group, but one of the things that we did was we tested whether or not these interventions worked during both sober and intoxicated states. And the way that we did this was through a proximal change experiment. This was an experiment that we did in the lab where we were in these experiments. What you do is you're looking for small, specific, measurable behavior changes. And if you can obtain those effects in the lab, these very proximal intervention effects on the mechanism that you think is underlying the behavior change, then you have some basis for which to then upscale the project and look at it in a fuller way. And so that's what we did in this study. It was an alcohol administration experiment. So essentially, they were brought in, they were randomly assigned to consume alcohol or a control beverage. Before they did that, they received their intervention or a control. And then we took them through a hypothetical sexual assault analog where they expressed their intentions to sexually assault the hypothetical partner in this analog. But they were told to use the skill that they had learned in the intervention while reading the analog. And so very briefly, if you want more detail, you can go to our health psychology article on this. We found that our very brief cognitive restructuring intervention did indeed improve emotional modulation. So one's ability to change what they were feeling in the situation. And that those changes in what they were feeling resulted in decreased sexual aggression intentions. For mindfulness, it was a bit more of a mixed bag. And let me go back. For cognitive restructuring, that worked whether or not they were intoxicated. We found similar effects for both the intoxicated and sober men. And so that leads us to believe that it would be an effective intervention for both sober and intoxicated perpetrators. Mindfulness was a bit more mixed. We found some positive effects for kind of directly when we didn't consider intoxication. But when we did consider intoxication, and specifically when we were looking at the group of perpetrators who reported the most severe sexual aggression histories and were intoxicated at the time of completing the dependent measures, they actually reported the most sexual coercion intentions, the highest sexual coercion intentions. And so there's a bit of work to do there to try to understand how we could potentially address that if we were to do this in a future intervention. So can we improve emotion regulation when intoxicated? I think there are some promising findings here. Our brief online cognitive restructuring intervention did improve emotion regulation when these perpetrators were intoxicated. And that improvement then resulted in reducing their sexual aggression intentions. Our effects for mindfulness were mixed, so I think we need more research there before implementing something in that vein. But in either case, this was all in the lab. And so we need a full scale kind of real world RCT to test whether or not these relationships that we're finding for our interventions would hold on real world alcohol involved sexual aggression. So just to conclude here, the points that I would most like you to take home from this talk are that alcohol-involved assaults are heterogeneous. We tend to have this kind of stereotypical idea of what happens in them, but there's a lot of heterogeneity across these assaults in terms of how much the victim was drinking, whether or not she drank it of her own accord, how much the perpetrator was drinking. So there's a lot to consider. That said, they do often involve predictable elements, and many of these elements can potentially provide malleable intervention targets. The victim-focused risk reduction is critically important, and I think we need to keep doing that work, but it's not prevention. If we want to prevent rape from happening to anyone, not just the people who are lucky enough to get those effective strategies, we need to be targeting perpetrators. And so bystander and perpetrator focused interventions demonstrate some promise for doing that. And so I hope that my work here is contributing to that in a positive way. So I just want to thank you all for coming. And I think I will end there. And I think we've stopped the recording and can move on to questions. So thank you.